Hey everyone, I'm Brian Weatherby, one of the orthopedic foot and ankle surgeons with the Steadman Hawkins Clinic of the Carolinas and Greenville Hospital System's University Medical Center. Today we're going to talk about an injury of the midfoot, which is called a Lisfranc injury. This injury is named after Lisfranc, who was actually Napoleon's surgeon in his army during many of his infamous battles and took care of soldiers who sustained this type of injury, and therefore it was named after him. What a Lisfranc injury is exactly is an injury that involves the midfoot bones and the metatarsal bones. These bones, as shown here in this model, are from the midfoot forward in the foot. The metatarsal bones are the bones that lay behind your toes, and they go from the knuckle joint or the metatarsophalangeal joint to the tarsometatarsal joint, working your way up towards the ankle. The other bones involved are again your midfoot bones, and these are what are called your cuneiform bones, and they are these three box-like bones you see here in the midfoot. What happens with a Lisfranc injury is the patient sustains a dorsiflexion force to their foot, which is a force that causes the foot to go upwards, as demonstrated here. This generally occurs with a fall down the stairs when the forefoot is caught on the side of the step or the top of the step and causes the foot to go upwards while the heel remains stationary. It is seen in car accidents when the patient places their foot on the brake or gas pedal, sustaining the same type of force. It can also occur in sports, often with offensive or defensive linemen when they are attempting to block and are inadvertently struck by another falling player, causing them to suffer a dorsiflexion force as well. Typically, this injury will result in significant pain about the midfoot area and a lot of bruising that is noticed that develops quite quickly. Oftentimes, patients might also, however, write off this injury and tend to try to shake it off and present in a little bit of a delayed fashion, and it might not be diagnosed until x-rays are taken. When this injury occurs and is x-rayed, it will often be noted that because of this injury, the ligament that holds the second metatarsal bone to the inside cuneiform bone is ruptured, and therefore a gap in between these two bones, such as demonstrated here, will develop. The ligament on the bottom part of the foot that connects these two bones has been termed the Lisfranc ligament, and this ligament is the strongest structure in the foot that holds this joint together. With extreme forces, such as in car wrecks or falls from a height, the ligaments that hold the other tarsometatarsal joints together can also rupture, allowing the entirety of the forefoot to come off the outside of the foot. The metatarsal bones may also displace upwards or downwards depending on the extent of the injury. With a Lisfranc injury in which separation of the bone occurs, it is important that this be addressed surgically with the placement of screws and other hardware to hold the joints in place. This typically has to be done through an open incision so that the bones can be reduced and put back into place just as puzzle pieces would be, and they are held in this place again with either a plate on the top of the foot or screws through the bones and across the joints. This hardware to fix the injury is only temporary, however, because motion across these joints is a normal phenomena and is required for full function of your foot. Therefore, once the injury is fixed, you will remain off of the foot for approximately 6 weeks, and then we'll begin progressive weight bearing week by week in this cam walker boot type device. Once you're full weight bearing without pain and past the 3-month postoperative mark, then you will be counseled on removal of the hardware. Again, removal of the hardware is necessary to allow the natural motion at these joints and to prevent any further breakage of hardware, which would make removal of this hardware significantly more difficult in the future, as well as making a fusion, if needed in the future because of post-traumatic arthritis, much more technically difficult. Lisfranc injuries may also be treated non-operatively. However, this can only be done if there is no gapping, as previously discussed, between these two bones. If it is treated non-operatively, this has to be done in a cast to allow the contour of the ligament to heal in the right place, and this will be followed by progressive weight bearing in a boot as well. Lisfranc injuries usually recover quite well and have a good prognosis as long as they are diagnosed in time. If you suffer an injury such as I've described, where your forefoot is pushed upwards and you have significant pain, swelling, and bruising, do not hesitate to come in and be evaluated and have x-rays taken so that this injury can be appropriately treated.